Hi, I'll be going over Suzie Smith's labs today. Suzie is a 48-year-old female who has a medical history of smoking cigarettes for 20 years and vaping for the last 3 years. She has minimal exercise and a family history of heart disease. She is on a diuretic Lasix. She works at a busy restaurant as a waitress. She has a presenting complaint about 3 days ago of new onset chest pain, admitted to the cardiac floor for further evaluation. First lab test we will be going over is her troponin 1. This normal range value is less than 0.35 micrograms. I found this on page 492 through 493 in week 5 lecture notes. Her lab results on day 1 were first at 0.2, second taken was 0.35, and third taken was 0.5. There were no tests taken on day 2 or day 3. These are rising up and trending up. They're significant above normal range. They require further evaluation. Usually this is done because of heart muscle being damaged, most commonly because of heart attack. Her BNP is next. Usual normal range is less than 100. I found this on page 115 through 116. Her lab results on day 1 were 842, which is above range, highly above range. This is trending up and it usually indicates severe heart failure. Next, we'll be going over sodium. The normal range for sodium is 135 through 145. I found this on page 467 through 469. Her lab results on day 1 were 138, which is within range. Day 2, 136, still within range, but trending down. Day 3 is 134, which is mildly out of range. Since it is trending down, we should monitor Suzie for dehydration and headache. It could be because of her diuretic use that is trending down the values. Next is potassium. The normal range for potassium is 3.5 through 5, and I found this on page 426 through 428 in week 2 lecture. Her lab results on day 1 were 4.2. On day 2, they were 3.8, which is trending down, but still in range. On day 3, it was 2.6, which is under range of 3.5. This is a moderate decrease. It could be because of diuretic use, but we should monitor for confusion and muscle weakness. Next is chloride. The normal range for chloride is 96 to 106. I found this on page 153 through 154 and week 2 lecture notes. The lab day 1 results were 102, which is within range, and lab results day 2 was 100, which is still within range, and day 3 was 98, which is within range, but the results are trending down, and we should monitor for signs of hypochloremia. Our next lab test is CO2. The normal range for this is 22 to 26, and I found this on page 57 through 59. Her day 1 results were 24, which is within range. On day 2, trending down was 20, trending down, but is still within range. On day 3, it was 23, which is within range. This usually means that it's a normal acid-base balance. And the next result is the BUN score, and the normal range for this is 8 through 20 milligrams per deciliter. I found this on page 95 through 96 in week 3 lecture notes. On day 1, the lab results were 15, which is within range. On day 2 was 18, still within range, and day 3 was 22. They were all trending up. On day 3, it was above range. This is a moderate increase and could suggest heart failure. We should use measures to correct the fluid imbalance and monitor Suzie. Her next lab test is the creatinine. The normal range for this is 0.6 to 1.2. I found this on page 198 through 199 in week 3 lecture. Her lab results on day 1 was 0.9, within range. On day 2, 1.2, which is on the higher end, but still on the range. And on day 3, it was 1.4, which is trending up and it was an increase. This could suggest possible renal damage. We should monitor her fluid intake and output. Our next lab test was glucose, and the normal range for this is 60 to 110 milligrams per deciliter. I found this on page 317 through 319. Lab results day 1 were 105. On day 2, it was 110, which is on the higher end of the range. On day 3, they were 125. This was trending up and an increase above the range. This could mean diabetes, but it could also be from a stress response from the body. We should monitor again for any more increase and possible further testing. Our next test was the total protein. The normal range for total protein is 3.5 through 5.5. I found this on page 430 through 431. On day 1, her lab results were 7.0, which was high. On day 2, it was 6.8. On day 3, it was 6.5, which was trending down, but still not within range. This is possibly from dehydration. We should discuss the results and educate Suzie on the diagnosis. Our next test is albumin test. The normal range for this is 3.5 to 5.5. I found this on page 32 to 33. Her first day results were 4.2. Her second day was 4.0, still within range. And on day 3 was 3.8. This is trending down and on the lower end of the scale. This is a mild decrease, which could be from malreabsorption of the albumin, and we can possibly administer IV albumin if this continues to trend downward. Our next test is the AST. The normal range for this is 10 to 40 units per liter. I found this on page 68 through 69. Her first day results were 22, within range. Day 2 was 30, within range but increasing. On day 4, it was 42, right above the range, and this is trending up. A mild increase could indicate liver damage or a heart injury. We should educate Suzie on the results of this test. The next test is ALT. The normal range is 10 to 40 units per milliliter as well. The page I found this on was page 31 through 32 in week 2 lecture. The day 1 results were 25, within range. On day 2, it was 32, and day 3 was 45. This is right above range, and this could indicate liver damage that could stem from heart damage, and we should monitor. Our next lab test was the total bilirubin. The normal range for this is 0.1 to 1.0. I found this on page 85 to 86 and week 2 lecture. The day 1 results for Suzie was 0.6, which was in range. On day 2, it was 0.8, trending up. And day 3 was 1.2, which is out of range and increasing. A moderate increase could suggest liver congestion from heart failure. More testing will be needed. We should prepare Suzie for that. Our next test is alkaline phosphatase. The normal range is 50 to 120 units per liter. I found this on page 35 through 36 and week 2 lecture notes. Her day 1 results were 130. Day 2 was 128, which is above range still. On day 3, it was 133, which is still above range. This is trending upwards. And an increase could possibly be due to her age because she is over 45, but also could be because of liver. We should prepare her for more tests. Our next test is procalcitonin. The normal range for this is less than 4. I found this on the week 4 lecture video and notes. Her day 1 results were 0.21. This means that there's no sepsis suspected. Our next test that we are going over is her CBC. First up is white blood count. The normal range for this is 4,000 to 11,000. I found this on page 519 through 523. Her day 1 results were 7,200, which is within range. Day 2 results were 12,500, above range, increasing and trending up. On day 3 was 17,000, which is highly above range. This could indicate an infection or tissue necrosis. from an MI, possibly. Our next test is the HGB test. The normal range for this is 11.7 to 13.8. I found this on page 322. Day 1 results, we heard test results were 13.5. On day 2, it was 12.8. On day 3, it was 11.2. This was a decreasing trend, all within limits. This is a moderate decrease, it possibly from dilution or bleeding. Her next test is HCT, I am so sorry. And the normal range for this is 36% to 48%. I found this on page 320 through 321. Her day 1 results were 40.2. Her day 2 results were 38. And her day 3 results were 35.5. This indicates a mild decrease and trending down. We should monitor Suzie for possible anemia, or since it's in range, just keep it in mind and monitor her. Our next test was our platelets. The normal range for this is 140,000 to 400,000 units per liter. This was found on page 418 through 419. Her day 1 results were 150,000, which is within range. Her second day results were 288,000, which is increasing but still within range. And on day 3, it was 410,000, which is slightly above range, increasing still. This could mean that there is an infection or inflammatory stress response. We should educate Suzie on her diagnosis for this test. Our next test to go over is neutrophil count. This normal range is 45% through 73%. This is found on page 520. Her day 1 results was 60, within range. Day 2 was 75, slightly above range, increasing. And day 3 was 78, still increasing above range. This is a moderate increase and could suggest infection or necrosis stemming from an MI. Our next test is lymphocytes. The normal range for this is 20% to 40%, also found on page 520 through 521. Her day 1 results were 30, which is within range. On day 2, it was 18, which is trending down and decreasing. On day 3, it was 15, which is still decreasing and below range. This could indicate heart failure or could be a stress response. Our next test is monocytes. The normal range for this is 2% to 8%, found on page 520. Her day 1 results were 8. Her day 2 were 6, and day 3 was 5, all within range but trending down. On our next test is eosinophils. The normal range for this is 0 to 4%. I found this on page 520. On day 1, the results were 2, which is within range. On day 2 was 1, and day 3 was 1. This is all within range and possibly trending down, but could be from a stress response. Body stress response. Systemic. On our next test is basophils. The normal range is 0 to 1%. I found this on page 82 and 520. The first day results were 0.5, second day 0.5, and third day was 0.5. This is all within range without any change. Our next test that we will be going over is her lactic acid test. The normal range for this is 0.5 through 1, and I found this information on our week 4 lecture. Her day 1 results was 1.5, on day 2 was 1.4, and day 3 was 0.03. I'm so sorry. This was a decrease, and it was less than 4, which indicates no sepsis. Our next test is D-dimer. The normal range for this is less than 500. I found this on week 5 lecture and on page 213. Our Suzie's day 1 results were 300, which is results were within range. On day 2, there was no test value. On day 3, it was 620, which is highly increased and trending up. it is above range. This is severe and could indicate a DIC or pulmonary embolism. We should monitor her for symptoms. Our next test is a THS. The normal range for this is 0.4 through 4.5. I found this on page 484 through 485. Day 1 was 2.3 results. This was in range. On day 2, it was 2.8, which is still within range. On day 3, it was 3.1, still within range, but trending up. There is a slight increase. This could possibly be secondary or hypothyroidism. More tests would be needed to indicate this. Our next test is T4. The normal range is 5.4 through 11.5. I found this on page 485 to 486. Her day 1 results were 1.1, which is below the range. On day 2 was 0.9, trending down, still below range. And on day 3 was 0.7, trending down. This could indicate hypothyroidism, and we should educate her on the diagnosis and monitor her for symptoms of hypothyroidism. Our last test we will be going over is our calcium scoring for Suzie. The normal range for this is 0. I found this in our week 5 lecture. Her first day results were 150, second was 150, and third was 150 as well. This is a moderate increase. It's staying at the same level, but this could mean that there is calcified plaque in her arteries, and this increases her risk for MI, and we should monitor her for symptoms of that. Thank you.